Hi, this is Sanjeev Roy. I am the director and head of the department at Mangalam Medicity Hospital in the Department of Cardiology. Conventional angioplasty is done with the help of a contrast injection, which commonly we call as the dye. Now, this contrast agent actually has to go out of the body through the kidneys. In those patients who have some kind of kidney dysfunction, these contrast agents have a bad effect on the kidneys, may worsen its function, and to the extent that some of the patient may land up in kidney failure with need of dialysis or renal replacement therapy. So it's very important that in those patients who have an advanced kidney disease, we should be able to protect the residual kidney functions so that we can defer the need of dialysis or renal replacement therapy in such patients. Very recently, we had a 58-year-old young gentleman who had an advanced kidney disease. He had been symptomatic with chest discomfort since 2017. The plan for the angiography was being deferred because of the kidney disease. So over the period of last 5 years, not only his kidney functions deteriorated, also his heart functions worsened, and he was not even able to walk 10 steps. So he was in dire need for further treatment because he was already on maximal dose of medication that can be given, and yet his symptoms persisted. So in such a condition, when we took him, his sugar control, he was a diabetic and hypertensive, both sugar and BP were not under control. We controlled it, and angiography was done with only 20 ml of contrast injection, basically to find out what the blocks are. And this was in proportion with his renal functions, which we measure or quantify in terms of EGFR, and the EGFR was 20 against a normal of 90 to 120 that we expect. So 20 EGFR, and we used only 20 ml of contrast to do an angiography. Subsequent to that, we explained him the need for going for a angioplasty because his creatinine was almost like 3.4, 3.5. So we hydrated him and then took him for an angioplasty. Now, angioplasty in such conditions are done without use of contrast so that the renal functions do not hit him, and then took him for an angioplasty. Now, angioplasty in such conditions are done without use of contrast so that the renal functions do not worsen. And this technique is known as zero contrast angioplasty. So we did a zero contrast angioplasty, and while doing that, what we do, we just see in the fluoroscopy, that is X-ray, we push in the wires, multiple wires are pushed in, and we use intravascular ultrasound, which is abbreviated as IVUS. And this intravascular ultrasound actually profiles the block, gives us the idea of the length of the block, the diameter of the vessels, and the location where it is. That can be actually precisely correlated with the wires. And without using a single drop of contrast, what we did is we did an angioplasty in his case, and we used 2 stents, and this was successfully done. His creatinine functions were normal, or rather improved, and we were able to successfully discharge him yesterday. So overall, we have been doing such complex cases with a zero contrast angioplasty, what we call it, and this involves use of an intravascular ultrasound and a highly technical, technically advanced catheterization lab, and of course needs a skillful, person doing it, needs some sort of expertise. And I think with this technology and the infrastructure that we have, we can, many more patients can be benefited by zero contrast angioplasty, particularly those with a